Hello, everyone, and welcome to today's edition of CovInspiration with Dyer Israel. My name, as usual, is Dyer Israel, and I'm glad to be with you today. I have today on the show an amazing young woman who has a history or a lot of experience and background in public health development in Lagos State, and she's worked. You would say that was born for a time as this, or was bred for a time as this, because she has enormous background in infectious disease control and in surveillance and prevention. Please welcome with me to the studio, Dr. Ola Finnih Awokoya. Hey, Doc, how are you?
Good evening. I'm fine, thank you. Oreolua.
Good.
But it's fine.
Oreolua, yes, Dr. Oreolua. How's it going, my sister?
It's going. It's going well.
So tell me first, what is your day like in this season? The senior special assistant to the governor on health. What is your day like? I want to, understanding your day, help us understand the day of the Honorable Commissioner. What is your day like right now?
Well, thank you for the invitation. What are our days like during COVID, and what could they possibly be like? A lot of it is strategy. It's in designing what the response will be. It is also in implementing the response and now trying to plug whatever issues we have, having designed that. It's also in listening to what is going on in the environment and trying to understand, how to then react. So it's how do you say, it's you sort of pre-plan, and then you also at the same time you are trying to react.
It would appear that you were actually born for a time like this. Like I said, you have enormous background in disease surveillance and prevention, disease control, inspection, and infection prevention, and other affiliate issues or areas in public health. What was the motivation to go into this whole area, and what is the addiction to public to disease prevention?
Well, I think disease prevention is probably the bedrock of us trying to move forward in terms of healthcare. And disease prevention is putting people's healthcare in their own hands. It means educating them, informing them about what and what not to do, lifestyle, environmental issues. It's the entire picture. Like you rightly said, my background is primary healthcare. And in primary healthcare, I was in disease surveillance. I worked in disease surveillance and disease control. And it's very interesting how the little things can make a world of difference. A little bit of information, a small jab from a vaccine this year can prevent you from so many things, making sure people know why they should look for clean water and how it saves the entire household from so many other things and reducing the disease burden. So for me, I've always been very passionate about prevention, passionate about surveillance. Where are the issues? What are the issues? And what can we do to make sure that we take care of all the problems in different spots? Lagos is very interesting, and as homogeneous as Lagos may seem, there different areas in Lagos have their different issues. Some are seasonal, some are year-round, some are environmental, some are demographic. So it's just a question of, I find it very interesting. The common threads that bind us are the differences that also make us unique and interesting.
What would you consider the biggest lessons that you're learning from this whole experience of coronavirus? What are the lessons that you're learning in terms of public health policy, public health financing, infrastructure? What are the lessons that this COVID experience is teaching us, in particular as Lagos State?
Well, I want to come from the angle of the fact that Lagos State has always been proactive. We didn't wait for this to happen before we had so many resources on ground. Generally, nationally, I know that in terms of healthcare, perhaps we're not yet where we would like to be. I think this has also helped everybody to take a very close look at what their health systems are like, and therefore start making changes to promote health systems. But I will say that Lagos State has been ahead of the curve in terms of training of manpower, in terms of even infrastructure. We have our BSL lab. We had the personnel trained to operate the BSL-3 lab. It's one thing to have the equipment, it's another thing to have the equipment. We have the isolation center in Yaba, and the isolation center was, even prior to all this, it was renovated and expanded. And we have always kept one step ahead. For me, it's very heartening. It's very heartening.
So, Dr. Ola, it's fantastic what you have said. So you've talked about the things that we're doing, but I want you to hone in on the lessons. What have we learned in what to do? So I'll give you an example. The executive governor promised during the campaign that he was going to increase the public health budget. So it was going to go from, was it 12% to about 18%, or it was either 8% to about 12%. It was one of the two, because I know education was one and health was another. And for that has been increased. But a lot of other things have also been done. But there must be lessons that we have learned that, okay, moving forward, these are things that, because Corona is novel, it has brought some new challenges, it has brought some new realities, and even for those of us in education, we're now looking at how do we begin to embrace technology more in our approach. Is there anything differently that you think that, oh, we've learned for this for the future?
Oh, absolutely. Now, I would bring it. I know that the question perhaps
Can you hear me?
Government. I can. Can you hear me? I can hear you.
Yes, I can hear you now. I can hear you now, yes.
Okay, great. So I would want to bring it and say, yes, government has responsibility, but one of the key lessons I have learned in COVID-19 is that people need to be more aware of what they can do and how they are responsible for a lot of their health. It is in making the right choices for lifestyle. It is in when people say stay indoors, stay indoors. It is in social distancing. People need to take responsibility for a lot of their choices, and people have not really understood that a lot of their health lays in their hands. So that is one. And of course, we've had to leverage on technology, and we're going to leverage on technology even more in the coming weeks. At the beginning of the response, a lot of our meetings were physical. But as we went along and as we saw what was going on concerning the spread, they have become virtual. And the efficiency of those meetings hasn't dwindled. We've done that. Yes, at the beginning of the year, the budget went on. But I'm sure you know that a lot of those activities may have had to stand down. Does not mean cancel, meaning a lot of the activities that were proposed at the beginning of the year have taken a sort of a side burner to the burning issue of COVID. And shortly, sooner than later, I believe that we're going to go back to all those other things, because as we speak, people need to immunize their children. As we speak, people need to still get treatment for their various normal issues. And so we have to learn to live with COVID-19.
Excellent. For all of us, it's been a lot of lessons in different ways, in terms of policies, in terms of, even individualistic, how we can do differently and how we must prepare for the uncertainties that the future holds. One question that bothers my mind, we're going to come to the achievement of the Ministry of Health and how the performance of the health sector of the BOS administration, which I'm excited about and I want to speak to you about. But one concern that a lot of people have had is, are the figures we're seeing, are they the expression of the realities on ground? In every night we see figures around 190, 180 from Lagos, 160 from Lagos. It's never past that number. Is it because of the numbers we're testing, or is it because it's never past 200 to 300 from Lagos? So it's like that certain number. Is that an output of the testing that we're doing? Are the numbers real?
The numbers are very real. Right from the beginning of this response, there has been transparency about everything that is being done. Every step of the way, the people of Lagos have been informed about what is going on. Now, we don't expect to see a jump from 50 to 90 to 200. You don't expect to see a jump from 50 to 200. I'm sure you've seen that from the beginning, the numbers have increased gradually on a gradient. And a few weeks back, the Honorable Commissioner for Health was talking about flattening the curve. Now, to flatten the curve, there are a lot of things that you. What was the lockdown that we had that was, partially lifted? The other thing was, even at the beginning, isolating people who had tested positive. That is not the strategy for all countries. And contact tracing and following up, those are some of the things that were done to keep the numbers low to the point where the healthcare system can cope. So the fact that we've not hit 200, like the commissioner said today in his press conference, we have not peaked, but we don't want to go from 50 to 200 overnight. We want to go gradually to our peak to the point where the entire system can cope with the new numbers. So that's concerning the numbers and the fact that those numbers are real.
With the lockdown partially for now, the partial lifting of the lockdown, are we seeing differences in the cases? What is the figure? What is data telling us?
The data is telling us exactly what you've said. We're nearing 100, we're nearing 200. It is still within the progression that we were seeing before. And we haven't seen, as of today, which is the 20th, I believe, of May, 21st of May, I believe that those numbers are still, we haven't seen a spike, which is probably what you're trying to ask about. We haven't seen a spike.
Moving forward to, some more matters around health financing, what do we see, not just in Lagos, but globally, and or let me say Africa-wise and nationally, in terms of infrastructure and support for our healthcare system? Are you projecting, and this is not in your capacity as SSA, this is just, your general opinion about equipment and financing of the healthcare industry and the healthcare sector for government? Do you see improvement from government in this area?
Okay, so I will not speak on behalf of government, but what I will speak about is what I have observed generally, globally. If you listen to the news, you will know what exactly is going on globally. Different countries have had different ways of trying to deal with financing this issue. A lot of countries have not only financed equipment, a lot of countries have given economic relief by way of cash now to their citizens. Now, health financing is complex. I know that in Nigeria, for the entire country, the private sector has also come in to play a part in financing this outbreak. But the government has borne the brunt of what has happened. So the welfare of the citizens, I guess, is paramount to the government, and I believe they are responding as adequately as required.
So let's talk about Lagos. What do you think are top 7 achievements in the healthcare sector in the last 1 year?
Wow, so many things have happened in Lagos in the last 1 year. There's so many things.
Those
The
are
first
exactly
thing,
what we want to hear, because I think many of them
yes,
are
I know.
underreported, or people are paying less attention.
Okay, sorry. So I think that we've had a lot of investments in the maternal and child care space. We've had opened 2 MCCs. We've had a massive renovation of the General Hospital in Lagos. We've had, and in terms of manpower, there was a huge recruitment drive at the beginning of the year for all the healthcare, the sector, right from tertiary to secondary to primary as well. We were trying to get on with that before we had this outbreak. And those are some of the things that have happened, of course, within the healthcare sector in Lagos that I'm aware of.
So we're talking about massive renovation of general hospitals, recruitment drive, MNCH. Can you go in deeper to just provide Lagosians the opportunity to understand and appreciate more the effort that Mr. Governor has been doing? Because I'm aware that health is the second item on the agenda for Mr. Governor in terms of the team. It's health and environment is the second agenda. I think we lost the SSA there for a second. Please bear with us for a second. I'm going to try to get her back. I'm sure she will join us back. We've been having internet challenge. I'm trying to. Please bear with us. Sorry, the special assistant phone is switched off. I think that she ran out of battery power from her phone because she was actually meant to be in her car before she went back into where she is temporarily. We'll be right back with the rest of the conversation as soon as she charges the battery for a few minutes. Thank you so much.